Perfect.
Thank you.
So welcome everybody. I am a Medicare broker. My name is Sandra Reith and I speak fluent Medicare. So my big thing with Medicare is education. I want all of my clients that I sit down with, and I give about an hour and a half, 2-hour educational meeting. I tell them, you think about what you want, what makes sense to you. We'll come back and revisit, go over everything we just talked about, because I feel I'm full of so much information, I kind of let their head swim. And I tell them, you can call me at 2 o'clock in the morning and ask questions, because my phone's going to be in my office and I'm not going to hear it. I'll answer you back the next morning when I wake up. So I like sitting down with people when they're turning 65. Okay, sorry.
Like karaoke.
Karaoke.
Saturday.
Connie would know. So I like sitting down with people, 64 and a half, whenever, give them an educational meeting, and then by the time they're 65, they're in a plan, they're ready to go, and they understand what plan they have, why they chose that plan. Not trying to smut anybody else, but what separates me from most Medicare agents, they're going to sit down with you for 30 minutes, and they're going to push those Advantage plans, and that's what they're going to do, and then they're going to walk away, and you'll never hear from them again. I live here, I work here. I am in the community during open enrollment. I'm at Walgreens on Continental every Tuesday and Wednesday from 9 to 1. I want everybody to come by if they can, ask me questions. And then I have the Chamber of Commerce conference room rented from 1:30 to 4. Then after that, I make appointments, so I live here, I work here. I just want to be available for my clients. I've been very blessed in this business. I personally don't have time to go by everybody's house during this time, but I'm available for phone calls, I'm out in the public. And we send out every year, I say we, my husband helps me, we just sent out 1,600 cards telling all my clients, hey, open enrollment's here if you have any questions. So, my clients know who I am. So that's what separates me from most other brokers, and I'm just being honest here. Starting with Medicare, you have to have Part A, Part B. Once you get Part A, Part B, Part A is prepaid. That came out of your FICA check all those years. So don't you call Part A free in front of me, it's prepaid. You pay dearly for that. Part B is going to cost the average income earner for 2026 $206.50. It went up from $185 to $206.50 for 2026. Once you have Part A, Part B, and any veteran in here, I'm a veteran, very proud of that. Any veteran that has TRICARE or CHAMP VA, don't you let a slick-talking agent put you on a Medicare Advantage plan. You do not need it. It's going to screw up your benefits. You worked hard for that. You earned it. Don't do that. They're going to try to tell you all the good points, and there's some good points. But your Medicare Advantage plan becomes primary. Your VA or your CHAMP VA or your TRICARE or your CHAMP VA becomes secondary, and it's going to mess up your benefits big time. Call me if somebody tries to do that. I'll set you straight. Because they're doing it to get a commission. Yeah. They're going to make it sound like they're there to help you, but they're doing it to get a commission. So call me, I got your back on that. So once you have Part A, Part B, you have two options. You have a Medicare Advantage plan option or a Medicare supplement plan. We're not supposed to say favorites, but yeah. You said it, not me.
I'm just ready to do all this.
You said it, not me.
I've been told that many
Say
times.
it again louder.
Supplement.
So, I agree.
Yeah.
So anyway, I'm here, I'm available, I'm big on education. I want you to understand why you're doing everything and what makes sense to you. And I'm always here for questions. Is there any questions? And I have some information. Yes?
So maybe you were gonna give us this anyway. I understand there's major changes this year. Can you highlight them for us?
Yes, so, August 16th, 2022, the administration signed the Inflation Reduction Act. We know who that was. He probably doesn't know he signed it. And we were told back in 2022, this is gonna be here to fight us for the next 4 years, and it has been. And it's really ugly this year. And we were told in 2026 it's gonna be the ugliest. So a lot of the plans that are exiting the area are usually the Advantage plans, the PPOs, because they're telling us and this is way above my pay grade, but they're telling us they're restructuring it. So they're trying to stabilize those plans because we only had HMO plans for a long time, and then they introduced the PPOs, everybody jumped on those. So they're telling us they're trying to restructure, but a lot of times when too many people get on one plan, it puts too much, the carrier's paying out too much money for that one plan, so they're trying to get an even playing field. So if you've heard a lot that the plans are exiting, there's still plenty of plans out there, but they are exiting with the PPO plans. Or, and some carriers are what they call crosswalking, so if the plan is leaving, they're crosswalking you into another plan that's comparable to what you're losing. But they're doing it to try to restructure and stabilize the plans, is what we're told. The Part B deductible, I'm sorry, Part D, deductible for 2026 can go up as high as $615 a year. So most of my clients do not pay that deductible because you can skirt around that deductible by using GoodRx. You can go to a Canadian pharmacy. They have a lot of generic medications that we don't have, and my husband's used the Canadian pharmacy for the last 6 years, saved us a ton of money. So just because you have a Part D plan, or it could be embedded in your Advantage plan, you don't have to use it to get your medication. So, you know, there's ways around that $615 deductible that you can always call me, because that's a lot of money. So they did away with the donut hole in 2025, so everybody had a donut hole where they paid toward everything, and then when the price got thousands of dollars, then you paid 25%. So they did away with that to help everybody, and now they get everybody up front with usually it's a tier 3, tier 4, tier 5 medication, which is a brand name. Most of the time, the tier 1 and tier 2s do not have a deductible. So if you have a tier 3, tier 4, tier 5, call me. We'll see what we can do to keep that price down.
Can you tell by looking at this card one person has?
Yes. Yeah, you have the Humana Advantage Plan, HMO.
What does that mean?
So that HMO means you have to stay in network for your providers, for your doctors and your hospitals.
Is that good or bad?
If you get to keep, if the same doctor stays along the whole time, that's a real good thing, because you're in their, program. But, depending on whatever your deductible is, or what, or your premiums.
So on the HMO plans, it's a 0 monthly premium. The advantage is 0 to little. To, you know, like one plan has a $44 premium this year.
Should I do something different this year than this, in your opinion?
Humana's my second choice. And the reason is they don't have as many doctors and hospitals in network as another carrier.
Well, who's your favorite?
Maybe you need to make an
No,
appointment.
I just say you have to give 3 options.
There's one carrier,
give
if
you
you can
that
ask
gun?
me afterwards,
What?
that I
I gave
gave
you the
with,
gun,
and they
didn't I?
have all the
Right.
hospitals and 85+% of all doctors in network.
Now,
Case,
which company
but
is
for
that?
Jim,
I'll tell you later.
what I do.
You just said you had something for him, but I didn't know
You're
what it was.
supposed to make all this stuff understandable.
And you can ask me afterwards, but
Yeah.
I shouldn't be saying
it's
this in
here.
front
It's
of,
okay,
for the
still have
speech,
it.
but I'll be there for
I
you
still have
afterwards.
it. Do you have a
I'll-
big
I'll
purse
help
or?
But, when, a lot of people this time of year for open enrollment, they wanna always
It's
look,
his.
I call
No,
it
it's
fluff.
armed, well, I'll
There's
talk to
either
him on the
doctors and
phone.
hospitals,
Please
or
say
there's
it.
fluff. So the fluff is the dental, a few years ago, another carrier
It's
had
too big for
$20,000
me. I'm gonna have
dental.
to get-
There's no
it
way
wasn't what I
in
thought.
God's
That
green earth
Burnus
you're gonna use $20,000,
CL
not
is
the way they have it structured, cause
big
they're only gonna pay 20% per procedure,
Oh, yeah, okay.
you know?
Right.
So, there's no way, but it looks good on paper. So you have to be careful with the fine lines, the fine print. So CMS, Centers for Medicare and Medicaid Services, pretty well gives all the carriers an even playing field. So either you've got the doctors and the hospitals in network, or you've got fluff. There was a carrier down here that's struggling, and they've changed their name a lot of times. Now, they had somebody at the gym for you to set your weights. So what I ask my clients is, when you get sick, do you want a doctor in the hospital, or do you want somebody at the gym to set your weights?
Right.
You're not gonna have both. So if you've got the doctors and the hospitals in network on these advantage plans, then you're not gonna have as much fluff, so the plans is not gonna be as rich, what we call, you're not gonna have the dental, you're not gonna have the over-the-counter products, all that kind of stuff. You're not gonna have CMS is not gonna give one carrier one plan that's just the golden egg.
Right.
It's an even playing field, so, you know, but this time of year, people wanna see, you know, their dental, their over-the-counter, and it's like, look for your medical, that's what you need. You know, my husband and I were just in the 6-car pileup on the 9th of September on the interstate. Did I plan on getting an emergency wreck that day? No, but it happened, so you won't prepare for the worst day of your life. And then, now's the time to think about it when you're sitting down making your decision with the Medicare plans. It's always too late once you get in that situation. So, any other questions?
Now, let's go over that deductible question again. Since the deductible is based on what you pay, if you don't pay, if you go around the system, how does that get you out of the deductible?
So if you only have a tier 1 or tier 2 medication, that's a generic medication,
Yeah, I
then you
understand.
don't pay. A tier 3, tier 4, tier 5, you pay. So you pay $600 up to $615 for 2026. Once you pay the deductible, then you have co-pays to pay, up to $2,100. So once your deductible and your copay equals $2,100, the carrier pays the rest. I go through Canada, I get a generic medication from my husband, I can get 84 tablets for $49. Why would I pay $615 and then $47.50 a month copay?
So you have to continue that all year long?
We've been doing it for 6 years because I'm not paying that
Okay, so
deductible.
you just don't use the health benefit in your insurance?
Correct, so
Okay,
he
I
has
got it,
2
I understand
medications, he has one that's generic, so we use the health care for that one, and the other one, we just don't use it.
Yeah, I got it.
And some people, they just wanna use their insurance, and it's like, well, if it saves you money to go around another way, save money, you know, 'cause I'm a penny pinching type one. Any other questions?
We got any doctors down here?
Another reason to look at a PPO plan, if you do go the Medicare Advantage plan side, is a lot of doctors only accept PPOs and not the HMOs as readily as the PPOs.
Well, that's really changed and switched.
Mhm.
That's really been a big change.
So I'm really a big fan of the PPOs. But Dr. Frank Monpetro, the new internist that's here, he only accepts PPOs. Lisa Olson, the nurse practitioner, she accepts HMOs and PPOs. But
We did have 5 doctors retire last year,
Yeah.
right here in Green Valley.
And the year
Yeah.
before that, we had 3 or 4 that retired, so
Yeah,
we've
so
lost
we've
a
had
lot.
big exodus
Yes.
of,
And a lot of them come down here to gain experience, and then they move on once they get experience under their belt, so,
nice.
yeah, we're suffering with doctors right now. Any other questions?
So do you make appointments or do you only see people at Walgreens to go over
No,
things?
I'm at Walgreens in the Chamber of Commerce, Tuesdays and Wednesdays. After that, I'm in appointments all the time.
Do you have cards?
Yes,
Okay.
yes, thank you. What other questions do you have? And I wasn't trying to be vague, I'll answer your question afterwards, but,
there's rules,
yeah,
She has to obey.
I'm trying to.
right?
Any other questions? So I guess it's Miss Connie's turn.
Thank you. I hope I don't get lipstick on there.
Right?
Hello, everybody. How are you doing? Happy Thursday. I'm Connie with Access Wisdom. We're an in-home care company here in Green Valley. About 3 weeks ago, we just celebrated our 26th year of having a storefront and providing services right here in Green Valley. So when I say shop local, I mean shop local. Not loco as far as being crazy, although I've been known to shop a little crazy at the rack or something like that. Anyway, the service we provide is really to keep clients or keep people in their home. Unless they got a fast hot rod car with a horn there. That's all right. So our care is to stay in the home. Our services are not covered by Medicare, cause our services are non-medical. I do have a couple nurses on hand that do medications, do what I call a pinch, a poke, and a squeeze, kind of do your vitals, check you out, advocate, chit chat with your doctor, especially if there's a medication change or something along that line. We provide caregivers, and caregivers come into your home. They do everything from bathing, housekeeping, meal preparation, incontinent care, and we also as well do co-manage with end-of-life and hospice care. With hospice care, I did try to get a gal in here with hospice, and her, this time of year, she was booked and was not able to come in. And hospice is 100% covered by Medicare. It's a great, it takes a village, so it's great to have hospice on board as one of the village people that helps maintain people in their home. But hospice wouldn't cook a meal for you, and they're not gonna change your laundry and those type of things, but they sure will manage your medication, bring your medication in, and really help with that time in your life. People do get kicked off of Medicare, or not, pardon me, not Medicare, but hospice. I just had a gentleman who, you know, if you would have asked us 8 months ago, we thought he may have met his maker by now, but no, he just got kicked off of hospice because he's doing better. So, you know, that's just, you know, part of the in-home care process is getting you back on your feet so you're not staying in a skilled nursing facility, or so that you don't have to move into an assisted living home. Not to say anything bad about assisted living homes, because I tell you, Green Valley, we have some really great assisted living homes here in Green Valley. I really do have to say. I don't do a whole lot in Tucson. I don't provide any care, but I've had my clients who have, for whatever reason, have had to move out of their home. Tucson, there's a more variety, and honestly, up in Tucson, it's more affordable. It's just, there's more options, so they really have to watch and be really competitive. But boy, Green Valley, we've got some really good ones. You're close to your family, you're close to your friends. So, you know, of course, my goal is to keep you in your home. You know, that's the kind of the name of my game, but I really do understand that there comes a time that you're not able to stay in the home. Usually, I'll be honest with you, it has to do with finances or a spouse. Because spouses are generally the primary caregiver, and if the spouse is not doing, you know, their own care, and what better care is it than personal care? You gotta take care of yourself and have someone helping you out. Again, it takes a village, whether it's an in-home care company, a hospice, physical therapy, your pastor or minister or whatever it may be, your friends. The Stephen Ministries, amazingly enough, they do a lot down here in Green Valley. So it really does take a community to keep a senior in their home. A lot of people in Green Valley do stay in their home. Green Valley has a lot of clients who don't have children, so we really play a big role in that, because you know, I had a couple kids, so when I get old, they're gonna have to take care of me. But in the same token, I would want them to have maybe a caregiver come in so that they can be my daughters and not my caregiver. It does take a lot. You know, let our caregivers do what the spouse or the kids, you know, let them have what they do and we do what we do. Bathing, housekeeping, meal preparation, that type of stuff. That way the primary caregiver, spouse, or family member can go take a nap, go take a bath, do their own doctor, do their own self-care, go get a massage, get your nails done, go to the Friends Indeed on Friday to have coffee and your blood pressure checked out with your friends or make new friends. But it is really, really, really important that the primary caregiver, whether it's a spouse, a child, or whoever it may be, is doing self-care. We certainly really promote that, because if you're the primary caregiver and you stroke out on us, we're going to be in taking care of both of you, and it means more care and of course, more money. Green Valley has a great community that was the savers, the penny pinchers, and a lot of people bought a long-term care insurance policy, which they're great, they're really great, but they have their rules. If you're driving and you don't need help with the shower, they are not gonna cover your services. They're very strict, those are the two things. But if you're needing help with bathing, incontinent care, you're no longer driving, it's a pretty good gig that really does help you stay in your home. Those of you who are veterans, there's some great benefits out there. One thing I think is a little wonky with the veteran situation is if you're 100% disabled, this particular benefit called the aid in attendance, which for the military person is about $1,800 a month. For the spouse is about $1,400 a month to pay for my type of services.
Wow.
But if you're 100% disabled as the veteran, you don't qualify for that. There are other things that help, but it's mostly in a care home and not necessarily in your home. So those are things you gotta look at, check out. I do have to say, state of Arizona, take care of our poor. But when I say poor, I mean poor, like $2,000 poor. Like you can't have more than $2,000 in your account. I am hoping that things will be changed and they will up that. However, with that being said, most of our people who are collecting Social Security, and truly honestly, most of the women who are collecting Social Security, because a lot of them in that age stayed home, took care of the kids, because that was the most important job, was staying home, taking care of our kids. Their Social Securities are little, and when their husbands pass away, a lot of times you only get a little bit of that. So the surviving spouses really have a hard time with making ends meet, and that's where the state of Arizona's All-Tex program comes in. Sometimes they only cover 8 hours a week, and then sometimes they cover 3 hours every day, but nothing covers 24 hours, 7 days a week. With that being said, not many people need 24 hours, 7 days a week. Believe me, I have my clients who do that. Those who do, and those who don't, we do, whether it's 2 hours a day or 3 hours 3 times a week or whatever it works to keep you in your home. My company, being local, I'm not a franchise, I'm my own boss. I take good care of my clients, my clients, but I take real good care of my caregivers, so they take good care of you, and I do believe that is a key to staying in business long, is taking care of your employees. My employees get benefits, bonuses, PTO, the whole 9 yards, so it's not just coming to work and bringing a private caregiver where you might pay $5 less an hour for a private caregiver than what you do for me. But if your private caregiver is sick or can't make it, and it's with a company with me, we would put in a substitute. Or if you had a private caregiver, there's no backups. And most of the time when you need us, you really need us. We have a 2-hour minimum. A lot of the other bigger boxes have a 4-hour minimum. And I understand a lot of people don't need 4 hours at one time. You might need 2 hours in the morning, 2 hours in the evening. That's one of my most #1 staffing that we do to keep people in their home. Is 2 hours in the morning, get you up, get you out of bed, get your meds, get your breakfast, get you changed, get your, whether you have an incontinent breaths done, do grocery shopping. Usually we're quite regimented, 1 day a week we pick to do that. So we really are, and I come from, we're a military family, so we do kind of keep things regimented, and that's how I kind of follow through with my business, is keeping it regimented. Same caregiver, same time, same bat station, no. But we do, a continuity of care with the aging is a very important thing, so that they get to know you, you get to know them, and have confidence and care. Because, I mean, some of the stuff we're doing for you is pretty, pretty up close and personal. So I want you to be comfortable with doing those up close and personal things with my caregivers. Usually they are seeing someone before you, and they'll see someone after you. So doing what we do is what we do. You know, the personal care, a lot of people are a little iffy with that, but that's what we do, that's what our caregivers do. And it's, again, to keep you in your home. Is there any questions? I know I talk quick and that type of stuff. We do a little bit, yes ma'am,
Are you hiring?
we are, of course we are.
Okay.
You
I have
bet.
questions to talk to you about.
Yes,
some
ma'am,
things,
you
so.
got it, you got it. So, a little bit about, my business prior to COVID, which, you know, changed the world. I had about 70 employees, 3 nurses and 2 paraprofessionals. I'm rolling right around 40 caregivers, and I'll be honest, in the last 3 months, I've had the most caregivers come in to hire. It is unbelievable, and I just hope and keep praying that people are ready to come back to work, because people have been a little lazy and not wanting to work. You know, people say, oh, well, you know, Walmart will pay me $17 an hour, and my caregivers are making anywhere between $18 and $23 an hour. Yeah, Walmart will put you in for 17, but they only give you 7 hours a week, where, believe me, I had 109 hours of overtime, so yes, ma'am, I'll be more than happy to put you to work. So, yes, absolutely, just chit chat with me, and do you know where my office is?
I don't.
It's truly, you can see it from the parking lot, it's
Okay.
just up the just
over
up the hill, yeah,
Okay.
in the BMO Bank building.
Okay.
You got it. Now, I do have to say, if you come in, I'm leaving tomorrow for Augusta, Georgia. Not to play golf, but to see my beloved 7-year-old granddaughter play baseball. You gotta smell them life's roses while you can.
Yes.
And so I'm taking a week off. My husband and I had to go see the grandbaby. Well, she's 7 now, but to go see. And again, that backs up, if anybody knows about military, especially Army. Augusta, Georgia is where Fort Gordon is. My daughter was stationed there. Yeah, absolutely. Yeah. So I'm a wife of a veteran and active duty. He was active duty for 22 years. Had 5 deployments, if you count Bosnia and some things before the Iraq and Iran. My daughter was deployed 2 different times. My son-in-law as well. My daughter's not retired, but she did 6 years in the Army, and she was an officer and outranked her husband. So they don't like that too well. So she did get out after 6 years, and my son-in-law retired 2 years ago. So that's kind of what we do. We also do, because we do have beloved snowbirds, and I love them coming back. I know they drive a little crazy, a little fast. But I love our snowbirds. Bring that revenue right back to us. I'm happy to have them come. We do some things for people who are not able to drive back and forth, or maybe they're single. Caregivers, we do where we go we'll just say I got someone going into Michigan, got a client from Holland, Michigan. So they'll meet the family at a hotel close to the airport. The caregiver flies in, gets the family member from the hotel, is what this plan is, and the kids drop them off with a beloved caregiver, bring them back to Green Valley, we get them set up in their home, and we do that type of care. We also have a gal who, they're not married, but they've been together for 17 years, and he's in a VA place in Yuma. Once a month, the caregiver gets in her car, takes her, drives her up, they stay at the hotel for 2 days, and then they come back. So we're really, what you need is really, what we're due. All of our caregivers are fully licensed, bonded, and insured, and depending on what your tax situation is, it's a tax deduction. It's part of kind of like I call it the child care credit, but it's about $7,000 a year. Again, it depends on how your tax structure is set up. But come January 31st, everybody's asking, hey, I need to know what I spent last year, and they send it into their CPA, and there's a tax deduction on if, of course, if you're spending $7,000 a year. Our average, yes, ma'am.
Well, Connie, your office is open all the time, right? Whether you're here or not.
Bingo, yes,
so
ma'am.
A person could fill out a job application.
Absolutely, you sure could. Yeah, just because I'm gone, I got 3 office staff, so yes, ma'am. Amber would probably be who, if you come in next week. Amber Brandes, who would be in the office next week. So, yeah, most certainly come in. I'm not a real big technology person, but of course we got the website and Facebook and all that stuff. But Amber is one who gets on there and takes a look at the applications. But with the I-9s, which is an immigration status, they need a wet signature. So you can do all the technology stuff you want, but you still gotta come in and give me a wet signature in order for us to hire you.
Right.
Yes, ma'am. We do advertise in the coffee, well, we advertise all over the place in that whole number 5 at Continental Hill, or Canoa Hills Golf Resort. But we do Gulf Haven, KGBY, we're getting ready to do the Boomer Fair in November, so come out to that. It's out there at the Desert Hills Lutheran Church, so that's always a good place to see what the local in-home care, or just the senior health, but the senior baby boomer fair. It's a lot of information, good resources. Any questions? I know I talk quick, sorry about that. All right, I should have been an auctioneer, right? Hey, hey, hey! All right, very good, all right. Have a wisdom-filled day, everybody.
Thank you.
God bless
Thank you.
America.
Yes.
Thank you so much, guys.
You bet.
Okay, so if you came in late, I have a swag bag courtesy of Connie at Access Wisdom, and it's not just swag, it's patriotic.
That's
It's
correct.
better than swag.
Been there, swag.